So as far as I have seen with the community, it's made up of a lot of immigrants. And with the aging, the baby boomers and the aging process, we do have a considerable seniors population. There are those who are very mobile and can get around, do not need assistance or do not need home care. But then there is a portion of the community that does, that is more homebound. And so services to the seniors should take into consideration both those who can commute and come in to different seminars and workshops, but also those who are unable to move around, whether it is because they don't have transport or because they have some mobility issues. But we do have that portion where if the services were to be taken to them, it would benefit that sector, because not all of them are able to come out. When we organize workshops and seminars, we do have a good attendance, but we are not reaching everyone. So that's one of the issues we would hope to address in the future, more of taking of the services to those who can't come out. Well, the strengths, as far as I am able to identify, is we have a number of people 80 and over who are still very mobile, who are still able to carry on their lives independently. I think that's a strength of the community. We also have family support. A lot of them do have family support, and that makes it easier in terms of the healthcare system. They are not that dependent on the system as we expect maybe with other segments of the population. So those are two. Plus there's good literacy in the community. So I think those are some of the major strengths. Yes, diabetes is somewhat prevalent in the community. Also arthritis. There are some heart-related issues like high blood pressure. There are a few people who have experienced strokes. Some have come back, without too much damage. But that is a concern. I would think those are some of the major ones: arthritis, blood pressure, diabetes. Those are the major ones. Well, we have addressed those concerns mainly from a workshop and seminar perspective, offering the advice and having the professionals come in. We have had the Diabetes Association, the Heart and Stroke Association. We have had the Toronto Public Health. All were very helpful and very willing to come out, because our program is conducted, our workshops and seminars, on a Saturday. This is to make it more convenient to the target group. But we know that these agencies, they work on a Monday to Friday week, but by and large they have been very willing to come out and give the seminars and the workshops. So that worked very well. We do have, like I said, a sector of the population that we need to take this information to. So in future, if we could put more emphasis on that. As far as referrals, many of the seniors are well connected to doctors. So we just found a few who needed that referral to doctors, and it was mainly because I think we had a couple of refugees, but by and large they all had their doctors. So it's not that they didn't have access to doctors. I think more understanding how to navigate the system is more helpful from an individual perspective. So that session that we had on navigating the healthcare system, I think it was very, very well received. and I think it's something we will want to do again in the future. We are thinking and talking about other organizations with which we can partner and run the program to offer it to more sectors of the population. We have Impact Community Services as a community-based organization from which we are offering the services. We do have other religious groups who either can form a community group like we have done or join with ours, so they can become members of Impact Community Services as well. We haven't gotten to the stage as yet where we have worked out the exact way that will happen, but we certainly are thinking and talking about it. We found that from our perspective, we didn't seem to be able to motivate our volunteers enough to get them committed to going out. There is some reluctance, and I think I understand part of it, but I think we need to delve deeper into that to see how people can feel more comfortable going out and offering these services, particularly to those who cannot come to us. For example, the computer classes. There are people who would benefit more from a one-on-one tutoring than from coming to a class such as what we offer. So we would like we'd like to know how can we motivate volunteers more so they feel more comfortable going into residences and offering these services. And that goes for other services as well, not just like the computer. For example, companionship and help. A lot of the seniors need help, say with groceries, shopping, but on the other hand, they themselves don't seem to be too comfortable accepting the help given. We have some of them who cannot prepare meals for themselves, and we have volunteers willing to go and do that, but the seniors seem to be skeptical about accepting people into their homes to do these things. So we need to look at how we can make it more comfortable both for the volunteers and to promote the program in such a way that the community knows it is a safe program, it is something that is accepted by the government, and so we tried, because we made identification badges and all of that so that they can present when they go, but there seems to be some reluctance in the seniors accepting the help. So we need to look at that. How can we improve that? We would like to have the program offered like even during the summer. We know it ends in March, and if we get funding again, it will start in September. So those months in between, we have had, the exercise program has been accepted very well, but people are asking, okay, what happens when it's finished? Because how much can you teach in that short period of time, you know? And the computer literacy is so important in terms of contributing towards mental health, because through the computer literacy, they're able to communicate with their relatives either via Skype or email or through chat, right? So it's needed to help with that side of the health, the mental health side, but not too much has been accomplished in terms of achieving that goal in the short period of time we had to offer it. So we would really like to see an opportunity to carry it on into right into the fall when the other program starts.